Good afternoon. I'm Stefano Ridonato from Leeds University, and I'm here with Prof. Volkmann from UCLA. Prof. Volkmann, thank you to be here. I wanted to ask you, what are your thoughts about the current trials in systemic sclerosis and future perspectives?
This is a great question. This is an exciting time in systemic sclerosis because for the first time ever, we have a number of different trials investigating different therapies with unique mechanisms of action. One of the issues, however, with these trials is that they're very focused on a specific subgroup of patients with systemic sclerosis. Namely, these are patients with relatively early disease who have diffuse cutaneous disease, and oftentimes they even have biomarkers or prognostic factors for having progression of lung disease or skin disease. The caveat here is that we're missing the broader population of patients with systemic sclerosis. So our limited patients, which you know comprise about 2/3 of a population of patients with systemic sclerosis, are not eligible for most of these trials. So while this is a very interesting time in clinical development, I'm hopeful that for the future, we broaden the diversity of these trials so that we can include more patients and understand how these therapies that are emerging work in these other important patient subgroups. This will also help us to advance precision medicine because we'll be able to know how these drugs works across the spectrum of patients with this disease. So thank you for your time.
Thank you very much.